Hello, we're going to talk about the junior and senior acute care clinical competency. This is accomplished in the spring semester of your junior or senior year. You have to do it both years, so it's a little bit different for juniors and not quite as extensive as the one for the seniors. So this is something you're eligible for starting in January of your junior year or January of your senior year. It must be finished before you're able to move on to the next step. So juniors to become seniors, you got to finish this competency, and seniors to graduate must finish this competency. Several criteria that are being evaluated by the faculty member. I'm not going to read those to you. You guys can read them on your own. We use a lot of the clinical competencies that CODA, our accrediting body, helps us with. For the junior competency exam, this includes everything up to but not including the actual treatment. So the patient does not need to receive treatment in order to pass the competency for the junior competency, but the senior competency, you need to do the actual treatment itself included in the appointment. Again, some competencies that we measure based on our accreditation with CODA. So, big picture, juniors, assess, diagnose, and treatment plan. They may or may not do treatment. It's not required for the competency, and no assistance until the treatment phase. For seniors, assessment, diagnosis, treatment plan, and then they must also complete the treatment. So if the patient does not receive treatment that day, this does not count as your acute care competency and will need to be accomplished with another patient on another day. You cannot have faculty intervention on that treatment either. No assistance for senior competency until the treatment phase, and the assistant cannot be a senior student. Must be a junior or lower year in school. Juniors may or may not complete the treatment, like I said, kind of up to the supervising faculty. If it's someone that's not very comfortable with surgical extraction, that's totally okay. Kind of play it by ear with the faculty and the student and discuss what's going to be best for the student and what's best for the patient. First and foremost, what's best for the patient. Juniors who complete treatment may receive faculty intervention and get advice on things or assistance completing the treatment if necessary. For the competency, we want you to inform the faculty member that you're going to do your competency prior to getting a start check, because as soon as you're getting a start check, you may be receiving some extra help from the faculty member, and we will likely ask you more questions during the competency than we normally would, and just make sure that you're truly exhibiting competence in acute care. You must work with the same faculty throughout the examination as well. Here's where you find the form in Axiom. It's called the Dental Emergency Junior Competency, and right under that, the Dental Emergency Senior Competency. Several boxes to click, things to fill out, type in your name, provider number, all of that sort of thing in the form on Axiom. As you can see here, this first tab, the self-assessment tab, is filled out by the student. You can fill that out after the patient is gone. So after dismissing the patient, this is when you start filling out this form. And then go over the appointment performance with the supervising faculty when time allows. So that might be right away. If there's other students that need their attention, then maybe you're waiting a little bit longer to fill out the rest of the form and go for your self-assessment. If you believe you made a critical error, make sure that you check that. That being said, you must have 100% on this competency to pass. It's either 100 or 0. So if you believe you made a critical error, that's saying that you believe you failed the competency. It's okay to fail this competency. It just means that you do it a second time or a third time or a fourth time. Hopefully everyone passes on the first attempt, but we understand that sometimes things don't go as well. That being said, you may discontinue your competency if it is in the best interest of the student needing more assistance from the faculty member, or in the best interest of the patient with the faculty member deciding that. So halfway through your competency, you may decide, this is not the right patient, this is not the right day. There's a lot of different reasons you might discontinue it. That's okay. You just do it another time, so don't worry about that. So once you've filled out the self-assessment as a student, you get a faculty member that you've been working with and discuss what you would do differently in that appointment, or what went well in that appointment, what maybe didn't go as well, and what you learned during your appointment with that patient. A faculty member will fill out the place where they put their initials. Make sure you put pass or fail below that. Again, it's only a pass if you get 4 out of 4 sections with no critical errors. And then we'll have them approve that form. The faculty member approve the form. Once that form has been approved, faculty member logs into Axiom and completes the competency tab, this second tab here on the acute care competency form. Fill out all of the yes/no answers to the questions here and decide if the candidate passed or did not pass the examination. Changes made when you're logged in as a faculty member just save automatically in Axiom, so there's no need to approve anything, it just automatically saves. That also is the case for the self-assessment form. So if you change anything in the self-assessment while a faculty member is logged in, then it will just automatically update. Make sure you put yes or no for all the questions, as well as yes or no next to passed. Faculty members should log out of Axiom once you are done with the grading. The forms are approved and saved. You do not need to do anything further. The only thing the student should do is document the day that they completed their acute care competency in case there's questions in the future. Sometimes Axiom just doesn't quite work right, so we want to make sure that we are able to find what day a competency was completed if the form for some reason doesn't get filled out appropriately, or Axiom somehow loses it, which I don't know how that would happen, but just to be sure, make sure that you document what day you went. Students who have critical errors will need to challenge the competency again until they're successful. So if you fail the first attempt, second attempt, you'll hopefully pass. Don't worry about that. You should fill out both tabs even if you believe the competency was failed. It is possible that a student believes that they failed, but the faculty member says, no, you did not fail. And you fill it out and put pass, and you're good to go. Students who make the clinical decision that they need more faculty assistance and intervention, for the sake of the patient, for the sake of the student, for whatever reason, if you're midway through, you can discontinue this competency without any penalty, if it's what's best for that particular day. If you've already filled out the form, you can have a faculty member suspend it, or possibly delete it depending on that faculty member's level of Axiom access. But if you haven't filled out the form and you decide to discontinue the competency, just don't fill anything out. That's okay. Again, if you want to discontinue the competency saying, hey, this isn't the right patient, that's totally okay. We would love these patients to all be new patients that have a new problem that is being focused on a limited basis. So almost all of these acute care competencies should be accomplished in an acute care clinic during one of your block sessions. They could be in general dentistry with a limited exam, but we want to make sure that the limited exam is evaluating a new problem. So if a patient was in a couple months ago for pain in the upper right, and then they're back with continued or differing or something that's also the upper right, we don't want that to be your competency patient because you already have an idea of what's going on, or you might already have the diagnosis and you're just confirming it. So we want it to be a new problem on a patient that has not had a diagnosis in the area related to their chief complaint in the recent past. As always, if you have any questions, reach out to me and I will do what I can to answer them. Thank you.